you don't know what you don't know, because if they've never experienced healthy, natural, restful sleep, they just don't know.
Hello, everybody, and welcome to another episode of the Raving Patients Podcast. As you know, I'm your host, Dr. Len Tao. I want to first thank our sponsors, both the Doc Sites and Dental Intelligence, for their support, allowing me to do this on a pretty much a weekly basis. Today's episode is called Airway is Life, and I'm super excited. We've come across each other. We've never actually been formally introduced till now, but I'm really excited to be speaking with a superstar in the industry, Meghna Dassani. Meghna, thank you so much for joining me today.
Oh my gosh, thank you for having me. And I know I couldn't believe we haven't connected before.
Yeah, so I reached out. I wanted her to be on here. She just released a new book. We'll touch base on that briefly, but I want to read her biography as we start this episode. So Meghna is passionate about helping adult and pediatric patients with sleep disordered breathing get the treatment they need to live healthier, happier lives. Throughout her career, she has gained invaluable insight into what it takes to implement those services into the practice, and currently shares her knowledge and experience in her role as a speaker. She's an international speaker that strives to leave audiences with the knowledge and skills necessary to deliver sleep apnea treatments. Before attending the Goldman School of Dental Medicine at Boston University, Dr. Dassani operated a successful dental practice in Mumbai. For the past 15 years, she's been practicing in Houston, Texas, where she continues to enhance her knowledge of obstructive sleep apnea and TMD. She's written 4 books, including the popular Airway is Life, and her most recent release, The Tired Child. Wow, so that's great. So to begin with, why don't you, I'm really curious how you got into sleep apnea and these types of, I was practicing for 23 years and I had little to no, not, I want to say understanding. I never chose to do it because obviously my career went in a very different direction in 2010 when I found marketing, and it kind of shifted my career. And as you know, I don't practice anymore. And there are other people obviously who focus on this, but what got you into sleep apnea treatments for kids and adults?
Yeah. So as you mentioned, Len, we really don't get any training in school, or at least I didn't when I was in dental school. But with anything that becomes a passion, I think what I've found is there usually is a personal story behind it. And you're the guru of marketing, so you know that. You're always telling us, like, tell your stories, right? And that's exactly what this was. We lost a family member that was almost like my dad. Not my dad. People think it was my dad. Thankfully, we still have my dad with us. That was like my dad. And we really didn't have any answers as to why. Everybody we spoke to kept saying, oh, it's genetic. Oh, it's genetic. I found that's the answer sometimes doctors trend towards when they really don't have answers for us. And sometimes it is genetic, but that's besides the point. And that was the day I was determined. I was like, I'm never going to want to live through this again. I really need answers. Like, why? Why did this happen? And how can I make sure my family never has to suffer through this again? And consistently, the answer, as I dug deeper and dug deeper, the answer that was presented to me was sleep apnea. And, he didn't have any of the treatment modalities that we now have available to us. I don't even know that a CPAP was an option. We're talking like 20 years ago. So that just set me on the quest to find answers for myself, for my family. Wasn't even thinking about anybody else. I'm the first to admit. But then what I found is when I purchased my practice after I graduated and, I had my daughters and purchased my practice, my family grew. It was now my office manager's dad. It was my favorite patient. It was our UPS guy, people that impacted my life every single day. And surely I did not want them to suffer the consequences like my family had. So we got into that. And, I started treating patients with adult sleep apnea, and we would have these conversations. And it took 2 things that really got me into the rabbit hole of pediatric sleep. One was a patient that I had helped with an oral appliance, an adult patient, to help with their snoring and their sleep. And he said, wow, doc, I've never felt this good before. I've actually stopped snoring. My wife is back in the bedroom, or rather, I'm back in the bedroom. My grandchild snores as well. Can you help her? And I was like, wait, what? And I almost kind of sort of didn't give it any thought. But the second thing that happened was, as we started to treat more and more patients successfully, I'd have friends that said, I want to learn how to do this. Can you help me? Can you show me? And I'd be like, yeah, come over to the practice and we'll kind of just, you can watch us, until a group of them said, like, just throw some slides together and teach us already. We'll buy lunch, we'll all hang out together, and we'll learn together. So I did just that. I put together a deck of slides, and my office manager, Christina, who's been with me for the 13 years that I've owned the practice, her and I were going through the slides. I was like, see if you can find any like typos or anything that I need to add or, change the order. And I had one sole slide on pediatric sleep, which basically said, what kids could present with, how their AHI is different from that in adults. And she stopped me and she said, Doc, do you think this is Avery? Now, Christina was pregnant with Avery when she came to work for me. So that's literally my baby. I've held her in the hospital. I watched her grow up. They've been in the office. And I stopped because she has 4 children and Avery's the sweetest child, but she was the one that always got in trouble at school. She was the one that was always struggling. She was always tired. She was the one I always had been like, be nice, be nice. And it stopped both of us. And I said, oh my gosh, we're missing an entire demographic of the population that we can actually impact. And they're still growing. We can have a bigger impact on their lives. So that is literally what got me into sleep, adult, pediatric, just personal, wanting to help the people I loved the most.
You found something that was very, very important and very, very significant to talk about and to learn about, and you've taken it to the next level. Just out of curiosity, for those that are listening and watching, is your practice focused on TMD and sleep, or do you do general dentistry as well, or are you now focused on just those things?
I am a dentist at heart. I love teeth, is what I tell people. They think I'm weird, but I own that weirdness. About 50% of my practice is sleep at this point. For me personally, I find when I bring sleep into when I'm evaluating a patient, be it adult, be it pediatric, it changes how I treatment plan. It changes how I look at them. It changes how I evaluate and assess them. So short answer, nope, not just all sleep. We do everything. Still a general dentist.
Got it. Okay, I was just curious on that. Obviously, one of the interesting things is that when you take on a different focus of your practice, okay, it changes the way you look at things. It changes the way you interact with patients. It changes the way you treatment plan, okay? You look at things very, very differently. So again, focus on the people who are listening or watching, and look, I was fortunate. I found a way out of the operatory. Not many dentists are very envious of the fact that I'm not practicing anymore. They wish I'm 49 years old, almost 50, that I stepped away from clinical practice because I had something else to do. A lot of times, by finding a new way of looking at things, it reinvigorates somebody, and then they just focus on this, and they can do this for many, many years because it's not as intensive as doing drilling and filling every day like we're taught to do. So can you just kind of talk about how somebody can learn how to focus their practice on sleep, how they can kind of change their mindset with things and really look at things very differently and hopefully thus change their way their career kind of moves along?
Yeah, the first step I find is being open. We're so used to drill fill dentistry that the thought of anything new sends us into a state of panic just because this does not involve picking up a handpiece. So it's like you almost have to step outside your comfort zone. And then there's the resistance with team. A lot of docs struggle with that. They're like, I can't get my team to get on board, or, I'm getting pushback from this team member or that team member. So those, I think, are things to make sure you are completely 100% sure that you want to go down that route. That being said, there are amazing courses that can train you and your team. I teach one of them. There's amazing other educators as well that do a great job. Pick one and go down the route with them. Establish your systems. That being said, no one educator has all the answers, or at least didn't for me. If I've read a description about a course that had the word sleep in it, I took it because there's so many ways for your brain to be able to absorb things. So that's what I tell doctors, you gotta be sure. It's a learning curve. We're learning to treat a medical condition. Yes, we have a dental solution, but at the end of the day, it's a medical condition. So you got to have that mindset shift, because once you get this, it changes everything. It completely changes what you do, how you do, the conversations you have. Was it an uphill battle? Totally. Because not too many were talking about it, where I was practicing. And like one Monday morning, I come in and they're like, oh, have you had a sleep study? Wait, you're clenching and grinding your teeth, which up until then I was talking about night guards and now I'm talking about sleep studies. Complete mind shift. And you barely get patients used to that. And I start talking about pediatric sleep and like tongue ties and breastfeeding. And we got the comments. It's like, oh, wait, what? Is she now going to start selling diapers? Why, yes, there's a thought. So you have to be ready for all of that. But once you find, as I'm fond of saying, find something that sets your soul on fire, there's just no looking back. There just isn't.
That's really interesting. I love what you just said, set your soul on fire, because I'm very fortunate, and I'm sure you're in the same way, that every single day I've woken up as an adult, I'm excited to do whatever's on my schedule that day because I'm passionate about what I'm doing. When I was focused on just dentistry, which was back in the early 2000s and in 2010, 11, and 12, I woke up excited to go to work every day. Now I talk to dentists all day long. I do podcasting. I wrote a couple of books. I have a Facebook group that I manage. I'm putting on an event in September. Every single day, whatever's on my calendar, I'm able to do that. I love the fact that you said setting your soul on fire, because every day I think I do that. And I'm excited to do what I do that day. So I think we're in a very similar boat that way.
Right. And it has to be very intentional though, right? It did not fall into your lap and you're like, oh, you got lucky. You did not. This was very intentional steps that you and I took to be able to get to this point. So understanding that there's going to be good days and bad days as we get into what we want to. But once you get it, boy, is it a whole different life.
I agree 100%. One thing you mentioned is that you need to pick a educator and stick with that person. So obviously there are a lot of people in the industry who talk about this topic. One of them is Aaron Elliott, who I know. How does somebody know? I mean, everybody looks at it differently. There are different methodologies. How does somebody who is not familiar with this topic go ahead and select an educator to work with?
It's really hard to answer that because you and I are friends. You've taken a course with Dr. X and you come to me and recommend it. I would definitely say, I'm going to give that a try. But that may not jive well with me. So I'd say have conversations with those mentors and see if the mindset, how they present, address things, what you're looking for. Is it something that they're seeking? Some docs are like, just give me the material. Does it mesh with what you need? And I say, go from there. So recommendations and have conversations.
Gotcha. And there's nothing wrong with going to multiple people and seeing which one you jive best with and just then selecting that person and following what they do.
Not one bit, because remember what I also said, pick a mentor and follow them, but also know not everybody has all the answers. The more you are exposed to the different ways of thinking, the more you're going to learn. So at some point, paths will cross and that's totally okay, but just start somewhere.
Gotcha. So let's talk about the financial aspect of things. Obviously, there's a cost for everything that you do in dental practice. The major costs involved are obviously the training and learning what you need to do to implement it in your office. Talk to the net result is that you're going to increase productivity in the practice. So can you talk a little bit about that aspect of it, how it changes the practice from a monetary perspective?
Yeah, certainly. So remember what I said, like it changes how you treatment plan. And I'm just going to use an example of maybe you are a new patient that walks into my practice. Yes, I'm doing my complete exam. We're looking at your gums, your periodontal health. We're looking, checking for cavities, restorative needs. We're evaluating your bite. I'm like, hey, Lynn, do you snore? Have you had a sleep study? We have the sleep conversation as well. And you tell me, you know what? I was diagnosed with sleep apnea like 5 years ago. They gave me one of those machine thingies. I could not use it. And did you know I can help you with an oral appliance? You're all on board. Now is the time for me to ask you the question, hey, have you ever considered straightening your teeth or getting that missing tooth replaced or getting any kind of cosmetic treatment done, whatever it is that you've been putting off? Now is the time to get it done. Because now I'm looking at you in a comprehensive way. Hey, let's get this done before I make you that oral appliance. That adds to quality of care, standard of care. I would want my doctor to do that for me. Forget adding the productivity from profitability from adding an additional procedure, right? You're now treating sleep. That's production on your books. So everything just ties into place, falls into place because you're now looking at things differently. Not to mention you've added a specialty procedure to your practice.
Gotcha. Now, I'm curious because I didn't do this in my practice, but do you, when someone comes in, even if they're not coming in for a sleep issue, do you at least have a discussion with them about sleep just as part of your initial examination, just because you're looking at things a little bit differently now?
Correct. Every single person, be it adult, be it a child, I am at that stage of my practice with sleep that main source of for new patients now is mainly referrals, be it from other patients or even the MDs that surround us. So it's not uncommon for my ENT to send over, when I say it's the doctor that I work with, to send over patients for, hey, go get, this looked at. Sleep MDs send us patients, cardiologists will send us patients, because you've then built up that network and, you need a tribe. It's not just me that's able to treat a patient. So yes, because everything gets looked at, adults as well as children, everybody gets a sleep screening.
Yeah, it's funny. I've gained weight over the years. Not a lot of us have because of COVID, but I was asked by my ophthalmologist whether I had ever been tested for sleep. And he said it was because I had something related to my eyes. And I was like, I know I sleep well. I don't wake up in the middle of the night. But when I sleep, I sleep. And he says, well, I think you should go get a sleep study. And I kind of didn't do it. And then I wore one of those rings that's out there, that not one of the medical, given by a dentist, to see what it came up with. And I came up as not having sleep apnea. But it's interesting how many people over the years said, because of my appearances, I don't snore, I'm not a snorer. But it's been brought to my attention multiple times that I potentially could have sleep apnea. So I think it's very interesting. That's why I asked if you specifically discuss it with all patients, regardless whether they're coming in or not for sleep apnea issues.
Correct. And, it's not just early on, it used to be like, oh, it's the older adult overweight person that we only had the conversations with, about, oh, do you have sleep apnea? Do you snore? But kids could have it too. Slender females could have it too. I have a college student she's an athlete and by no means would be considered overweight, that has sleep apnea that we're treating. So I always like to make sure I'm screening. We're having these conversations about their sleep, about how rested they are, sending out for a sleep study. I'd rather be told, oh my gosh, Dassani worries about too much, and it come back negative, as opposed to getting a phone call saying, Mr. So-and-so had a stroke, or Mrs. So-and-so passed away, or had a heart attack, or whatever. So I'd rather be the doc that worries a little too much than not at all.
No, I think that's great. I think that's great. You mentioned your team. You mentioned how your front desk person or office manager had her daughter, an issue with her daughter. Talk to me about how you made the transition with your practice and or had the buy-in from the team, because I know a lot of decisions that we make as practice owners are dependent on how the team is going to react. And like you said, sometimes the team doesn't want to buy in. So can you talk a little bit about, to the audience here specifically, that if you make a shift in your practice like this, how to get the team on board?
A lot of times our team members typically have somebody that they know has sleep apnea or they have concerns. When I speak, when I teach, and I'm on stage, and I know you know this too, and the minute I get into pediatric sleep, suddenly there's a shift. And I'll have people come up to me at the end and go, well, my daughter has these signs, or my son had his tonsils taken out. It suddenly becomes extremely personal. So the buy-in for the pediatric aspect was like, I didn't need any, because they each had children that they were worried about. And then the same thing for, when we got started with adults, this hits home for a lot of people. I find the biggest struggle team has is they think it's one more thing they're going to have to do, one more conversation they're going to have with the patients. And my hygienist used to worry about, but doc, we're going to run late, and we hate running late. So as long as you have those systems and training and protocols put into place, it's very seamless. So just making sure, docs, you understand that you got to have a system, you got to have a protocol, you got to have your team trained to be able to support you. And then sleep is team driven.
That makes a lot of sense to me. And I hate to say it, it's almost like you almost know somebody who has sleep apnea and the effect that it's had on them, similar to, look, we talk about cancer, everybody knows someone who's been affected by cancer this day and age. And that's why you get buy-in on cancer treatments and stuff. I think it's the same way when it comes to sleep apnea, because you eventually know someone who's been affected by it or has it themselves. I want to ask you one more question when it comes to this. And that question is related to raving patients. Okay. In the sense that one of the other effects of this is that you have these patients who have been struggling with something that may have been undiagnosed for years and years and years. And they come into you put them through a sleep study, you eventually find out they have sleep apnea, and you're able to treat it from a dental perspective. That creates a whole different vibe with patients. Can you talk about the effect that, maybe tell a story or two about how you've affected some patients' lives? Because that really is what we're doing here, is you're basically changing someone's life at this point.
Oh my gosh, I can give you stories for days. Couple of my favorite ones. We had a 16-year-old boy come into the practice, brought in by his mom. And typically when we have a new patient or a consult, my team brings them back. They do whatever I need. You need x-rays, photos, whatever it is, go over medical history, talk to mom before I come in. This was a 7 a.m. patient, and my assistant came to get me. And she was like, "Doc, you might want to start with this one because I can't get nowhere." I was like, "Wait, what's wrong?" She's like, just do it already. Go in and talk to them. I said, okay, walked in, and here's this very sullen 16-year-old boy just sitting slouched down in the chair. And I was like, "What's up, buddy? What's going on?" And he did not want his mom in the room. He did not want the assistant in the room. And I was like, yeah, unfortunately, I got to do what mama wants to do. So let's have this conversation and, we'll take it from there. Well, he was in my practice because he was wetting the bed. You and I both know as dentists, nobody thinks of us first when their child wets the bed. He'd seen a urologist, he'd seen a nephrologist, his pediatrician, every other specialist they could see, cleaned up his diet. He didn't drink water after whatever time. They'd done everything. And all I said to mom was, has anybody evaluated his sleep? Let's start there. So, we addressed his sleep issues. We got him into treatment. And do you have any boys, Len?
I have a 15-year-old son.
Okay. So, that age, they're not all about the hugs. I have 2 daughters, but I have a ton of nephews. So I know 16-year-old boys are not about the hugs. They're like, stay away from me, at least with, other people. 3 months later, he came in for a follow-up appointment. And, we have a long hallway, 8 operatories down the hallway. And he was walking in and I was walking out of the break room to go to my office. And he saw me and he ran down the hallway, gave me a big hug, lifted me off my feet. I'm hard to lift up, by the way. Lifted me up, and he just whispered in my ear. It's like, I have not had an accident for the past 2 weeks. I was like, my day cannot get any better. My day could not get any better. It's one of those things that still gives me goosebumps every time I talk about it. So needless to say, mom was super thankful, because could you imagine a 16-year-old that does not do sleepovers, does not do camp, is worried about, his friends finding out he wets the bed, the social and emotional impact that has on their lives? It's unbelievable. And then, with adults, of course, we had this one couple that came, and it's usually the men that are drugged in by their women, by their female spouses. It's like, he snores, he can't sleep, and I can't sleep. And he's like, what? I sleep just fine. And the wife is over there sitting there sobbing because she knows he stops breathing at night. And she stays up terrified. What if he doesn't start breathing again? So she's always elbowing him. It's like, roll over, honey, kind of thing. And, he had a sleep study. We fitted him with an appliance. He was doing great with it. And when she came in for one of the follow-ups with him, she was still crying. And I was like, now what's wrong? Why are you still upset? For one, she was sleeping better because she wasn't worrying about staying up. So she felt so much better. But she's like, at least I knew he was alive then. So every time she kind of woke up with the fear, it's like, oh my gosh, I can't hear him. What's going on? Only to look over and see he's fine. He's fast asleep. And she could, without worrying, go back to sleep. And these are the patients that send you their families. They send you their neighbors. They send you their loved ones. It's like, you don't know what you don't know, because if they've never experienced healthy, natural, restful sleep, they just don't know.
That's 100% right. That's awesome. Those are awesome stories. Thank you for sharing them. I've had a couple of those, again, not to the same level, but I've had a couple of those from a dental perspective where the patients, they think they think you're the best thing since sliced bread, and all they do is talk about you. So it's a very nice feeling you get when you know that patients are very appreciative of what we do as practitioners and affect their lives. So I really appreciate you sharing those stories. So I want to shift gears for just a couple of minutes here. As those people who listen to my podcast, frequently know, I like to do a little Q&A more on the actual person rather than what they're talking about. So this we're talking about is the business side of dentistry. I'm going to ask you some questions. Again, just very quick answers. You don't have to really go into long diatribes. The president needs you for a special project. What expertise do they come to you for? Obviously, that's going to be sleep apnea, in my opinion.
Yes, how to get our kids to be sleeping better, healthier sleep. Yes.
What have you given up on that you wish you never did?
I don't know that, it was really hard leaving home to come to the United States, but I also know I wouldn't have gotten these opportunities had I not. So I don't know that I wish that I hadn't.
Got it. What book do you wish you went back and read and reread, and it has a major impact on your life the first time you read it?
The Autobiography of a Yogi.
Okay. Similar to this, what is your favorite book or a book that you recommend others read as well?
The Autobiography of a Yogi.
Okay, there you go. Has anyone in your network been important to your journey?
Almost everybody that I surround myself with impacts my life. If you're in my life, you matter, and you've impacted my journey.
Great answer. What is your greatest fear and how do you manage it?
My greatest fear revolves around my children. Am I enough? Am I giving them enough, doing enough, being there for them enough? And I have to remind myself that they are amazing human beings. So maybe I'm doing something right.
Yeah, but you also have to know that, being a child, you have a 16-year-old, how old's the other one?
18.
16 and 18-year-olds, the world's very cruel, and the kids in school is very cruel, and you hear about all this bullying and stuff. There's so much you have to worry about. You have to constantly check in with your teenager to make sure they're doing okay this day and age. So,
correct.
Do you keep a journal, and does it help you?
Yes, I journal every day. That's a non-negotiable for me.
Okay, I think that's awesome. How do you capture and track ideas? Do you use voice memos? Do you keep a notebook?
My journal kind of plays some of that role, so yes.
Here's an interesting one. I'm curious what you say for this one. What profession do you think is most undervalued today?
Oh my gosh, dentistry. We're hated on so much, but we actually change lives and impact lives.
Yeah, that's amazing. So, and last question, we'll see if you can come up with an answer for this. This is one of the toughest questions that I ever ask anybody. So, if you had a lemonade stand, what would you name the lemonade stand?
We would actually name it Alex's Lemonade Stand after the nonprofit that they have. My girls have done this just pre-COVID, and it was such a fabulous experience. We would just continue to support them.
That's the first time in all the times I asked, and I'm waiting for someone to say Alex's Lemonade Stand because that's the most popular one, and nobody's ever mentioned that before. They all struggle with a name. They come up with something, So that's really interesting that you said Alex's Lemonade Stand. So Meghna, thank you so much for sharing your expertise and experiences. I know you have a couple books, so why don't you talk about your books briefly? And I know you have an event coming up in September as well. So why don't you just talk to the audience about that?
Well, my previous book was called Airway is Life, and that touched upon sleep and sleep disordered breathing and airway issues in families. And I almost felt like I didn't do enough justice to the kids, which is why The Tired Child was born. So this goes into everything sleep as it relates to children. As far as the event, I do host an annual summit every year called guess what? Airway is Life Summit. This year it is in Houston at Space Center Houston. We're literally inside the Space Center. September 8th and 9th. And we're going to have everybody that matters in being part of your sleep team be, one of our speakers. So we have a sleep MD, we have an ENT, we have a myofunctional therapist. We have somebody that's going to talk about the business side of, medical billing and such. So yeah, it's going to be an amazing event.
And you said it's September, is it 7th and 8th, you said?
8th and 9th.
8th and 9th. So this was awesome. Thank you so much. I really appreciate it. So just so people know, I also have my event in September. It's 29th and 30th. It's called Supercharge Your Dental Practice. It's in Delray Beach, Florida. It's focused on the business and marketing side of the practice. We have 18 speakers, including myself, over 2 days for 14 hours of CE. So you can go to superchargeyourdentalpractice.com and check out information on that as well. Meghna, you were amazing. Thank you so much. If you want, I forgot to ask you a question. If people have any questions for you and want to reach out to you, what's the best way for them to do that?
Yeah, well, thank you for having me. The best way to reach me is on social media. I'm always on Facebook. Social media handles are Healthy Sleep Revolution for me, be it Facebook, be it Instagram, be it Twitter, and my website. I personally answer all emails, meghnadassani.com. Just send me an email and I will get back to you.
Great. So you have her information. If you want more information about bringing sleep into your practice, she's one of the women to reach out to. This was awesome. Thank you so much. I want to thank the sponsors, both Dental and Tel and the doc sites for their support. And as I always end these podcasts, remember your reputation matters. Until the next episode, we'll see everyone soon. Thanks again, Meghna. I appreciate it.
Thank you.